Hi everyone, this is Indie Journal Live, and joining me is Carole Meyers. She's a health policy expert at the University of Tennessee. Carole, I want to start off by talking about where we are in the process. A lot of people are very worried, and you mentioned to me before this that they have reasons to be worried, but I want to talk to people about the fact that we are still in the middle of the legislative process and nothing is going to happen overnight.
Nothing's going to happen overnight, but there is an expectation, particularly among the Republican leadership in the Senate, that this will move quickly. They're moving it to a vote next week. And given the process by which they're moving this bill, it could move rapidly. There's rules regarding bills that are brought forth under the reconciliation process, which could limit debate. But on the other side, there's some things that might protect those who oppose this bill. So I wouldn't be complacent. It's been a stated desire to get this moving and to keep it moving rapidly. I think the more time that there's to shine light on this bill, the more opposition there will be. So that's a motivation for those who support the bill to continue on the fast track.
So let's talk impact. Bottom line, the richer Americans are going to pay less. Folks that are middle class and below are going to pay potentially a lot more.
Right. The savings that are being touted as the advantage of this bill basically come on the backs of vulnerable and poor Americans. They're wiping out the taxes that currently support the Affordable Care Act, and that's $594 billion in tax revenues that will go basically to the most rich Americans. Americans that make $200,000 or more will see tax breaks, and 80% of the tax breaks will go to those who make $1 million or more dollars a year. The other really sad part of this is that costs are cut by cutting coverage and cutting subsidies to pay for coverage to those people that are low income and unable to afford health care costs.
You're talking Medicaid, and we're talking $800 billion here, potentially.
Right. The CBO projected on the House bill, we're still waiting on the score on the Senate bill, that there will be a loss of $880 billion or some number close to that over the next 10 years.
I mean, that means everyone's going to feel it. We're not talking about a small reduction of benefits potentially, though it is up to each state if this were to go through.
Right, but most states have a balanced budget amendment, and most states operate on very narrow margins, and there's competing demands for healthcare, education, roads, and other needs. Let me maybe translate this for you to what it might mean to you and I that don't, I assume, have Medicaid, that we're looking at employer-based coverage. There's some projections that say the typical deductible, which today is $2,500, would go up to over $4,000. So the ripple effects from the demise of Medicaid as we know it will be felt throughout the system. It will impact people with employer-based coverage. There'll be impacts on Medicare. So I don't think anyone should hide under the false protection that I'm not on Medicaid, so this doesn't affect me. It will affect all Americans.
There's a bit of a question about pre-existing conditions. Some say that it doesn't eliminate the mandate to accept folks with pre-existing conditions for policies to be offered to those people, but it does lessen the regulation for it, correct?
It lessens the regulations and essentially gives the states authority, as I understand it. The bill just came out yesterday. As I understand it, gives the states authority perhaps to eliminate the protections for people with pre-existing conditions. It eliminates the essential benefits, which is another protection. There's a lot of talk about what's going to happen to coverage for contraceptives, mental illness, prevention care. There's another piece that's not talked about a lot that concerns me. It wipes out a very significant amount of public health funding. An investment in public health is a long view that basically changes our healthcare system to be more oriented to deal with things before they happen rather than waiting for when they happen. So this is also a very far-reaching implication if we move away from investments in public health. So there's a lot not to like.
A lot of people have shared that sentiment to me. You alluded to this at the beginning of the interview. There is still time to reach out to your senator if you are just frustrated about what you're seeing playing out in Washington.
Oh, yes. That to me is the most simple thing we can say is use your voice. Flood the phone lines, flood the email, show up at town hall meetings if they're holding them. I'm part of a town hall meeting where there'll be no legislators, but we're going to have a large group assembled, and let our views be known. Right. There are issues that need to be addressed, but the solutions that have been proposed are not the right solutions. We need to have dialogue about this. You need to be in contact with your elected officials to let them know how this is going to work out back in their districts.
Well, Carole, thank you for your perspective. Of course, we're all watching Washington and what happens, this drama playing out in real time, and like you said, something that will affect all of us. Thank you again, Carole.
My pleasure. Thank you.